Good afternoon, good evening, and good morning, everyone. I'm Kumanan Rasanathan at the Alliance for Health Policy and Systems Research, and it's our immense pleasure to have this webinar today, New Frontiers in Health Policy and Systems Research. And there's many reasons we're having this webinar today. One is that we're actually taking advantage of the fact that we have a number of giants in the field of health policy and systems research here this week in Geneva for a meeting looking around exactly this topic on new frontiers in health policy and systems research. But we also wanted to have a public event to reflect on the field and take advantage of the fact that we've had these very interesting discussions over the last couple of days. The other reason that we wanted to have this event was we also wanted, as a health policy and systems research community, to celebrate Professor Lucy Gilson, who was late last year awarded the 2024 Virchow Prize at the World Health Summit in Berlin. And for those of you who don't know, the Virchow Prize, it's a relatively new prize, but it's one of the premier prizes in global health, recognizing a lifetime of achievement to improve health and improve health equity. And so today we're privileged to have intervention from Professor Gilson, and then we have a very distinguished panel who will then reflect on the field together. I'll introduce Professor Gilson, Lucy, and then Dr. Akukwami, who is the unit head leading on capacity strengthening, field building, institution building at the Alliance, will moderate the rest of the session. Before I do that, though, this meeting is occurring under the WHO Code of Conduct, and so it's important just that we remind colleagues on that. Essentially, if we can move the slide. So, right, okay. So essentially, be nice to each other. The provisions are there, and it's very important that everybody is able to contribute to this meeting with respect and with dignity. So thank you for that. And then I'd also just remind our speakers here to make sure that when they speak into the microphone so that everybody can hear you online. And thank you to those of you joining online. We have a very large number of people, and it's really great that you've all made the time. So to consider new frontiers in health policy and systems research, who better to have to lead us off than Professor Lucy Gilson, who is a giant in our field. And I think everybody in the room, those of you online cannot see, has probably personally learnt from Lucy. Lucy has currently joined appointments at the University of Cape Town in South Africa and at the London School of Hygiene and Tropical Medicine in the United Kingdom. But Lucy started off her career, as she'll tell you, working in policy and planning in Swaziland and in other countries in Southern Africa. And she is really someone who has helped construct this field of health policy and systems research over the last 30 years. And she was awarded the Virchow Prize for her lifelong contribution to our field, where she's been pivotal in developing the field, emphasizing interdisciplinary approaches that integrate sociology, anthropology, political science, and economics with public health. Lucy lives her values of equity and social justice, and really that's what drives the mission for her of health policy and system research. It's very much an applied field. So today, the field is around, formally about 30 years old. The Alliance is now formally, over 25 years old. And so today, in this moment where the world is changing so rapidly, where things that we have taken for granted are deconstructing before our very eyes, what better than a field that combines epidemiology, political science, economics, anthropology, and organizational theory, among others, law, and tries to bring together researchers, policymakers, communities in a combined praxis to improve health and health equity. What better field to contribute to this moment? And that's perhaps what we can reflect upon today. So with that, and looking forward to both Lucy's intervention and then our panel, who Aku will introduce in a moment after Lucy speaks, let me hand over to you, Lucy, to give us your reflections on the field and its new frontiers. Thank you.
Great. Thank you very much, Kumanan. Thank you to the Alliance for organising and hosting this event. Thank you to those of you in the room, and thank you to those of you online. It's a real privilege to have an opportunity to reflect on this field. And I want to start by being reflexive as a good HPSR practitioner. I want to acknowledge the privilege of reflection at a time of challenge, stress, contestation, and yet was not the world ever thus. I want to acknowledge that the reflections I'll present are absolutely my own reflections, rooted in my own experience, my own understanding of the world, my own understanding of action. I came into the field, and I feel I've grown with the field, from a development studies background, and a natural inclination to see patterns and trends, systems, if you like, in the world around me, as well as a deep curiosity around the politics of social change. And for me, research is political. It must be linked to action to contribute to the task of bringing about social change. So in these reflections, I want to start by looking a little bit at the foundations of HPSR, think a little bit about its evolution over time, and then look forward. So to begin with, let's remember the definition that is established of this field, and I've highlighted in red the words that I think are particularly important. It's about how societies organize themselves in achieving collective health goals. It is, in essence, about collective health action. It developed in its early days, or out of the history of the debates around comprehensive versus primary healthcare, for those who remember those debates. It developed as countries responded to the challenges of structural adjustment programs. It developed as challenges in meeting the Millennium Development Goals led to an emphasis on the need for systems. And that background is important to remember. And it emerged then to support a systems-led approach to strengthening the healthcare platform, and an integrated approach that recognized the horizontal supports needed in a healthcare system. But it also emerged to support a strengthened focus on health over healthcare in system development, and in recognizing that health systems are themselves spaces for action towards social justice and health equity. It recognizes that health itself is political, as are the processes of policy and system change, and that health research of all sorts should be driven from the countries in which that research is located to address local needs. This slide, which some of you may recall, locates HPSR in the broader terrain of health research, recognizing that it has a population level focus, a systems level focus. It embraces aspects of clinical and behavioral research, and critically it draws in social science lenses and perspectives to understanding the experience of health policy and systems. It has a macro level addressing national and global frameworks or needs and demands, a meso level focused on organizational and local level, and the micro, the person in the system. There are a range of related areas of research, and there are many names out there for different types of science that are related, and I would say could fit under the umbrella of health policy and systems. And over on the right, you'll see that I've put the 2012 HPSR strategy of WHO, Changing Mindsets, to remind us that it is a field of action. That strategy says HPSR should be the GPS of decision-making. So how has it evolved over the years? What have been some of the key developments in the field? So on this slide, in the blue book, I've tried to identify some of the key steps in the evolution of the field, from the foundation of the Alliance in 1997 through to the first global symposium in 2010 in Montreux, and subsequently the formation of Health Systems Global. There have been many steps of development. And in the pink box, looking only at the Alliance's own flagship publications, critical products, I've highlighted that the field is really consolidated, has developed. There's a body of work thinking about what HPSR is. There's a range of other products that take forward conceptual development around the field. And then there is the work that focuses on how to do HPSR for the researchers, for the evidence synthesizers, and also for the practice world, that we need to think about collaboration as a part of how we do HPSR. But of course, there have also been challenges and limits, and I want to reflect on them. Challenges derived from contexts that do not always value or appreciate HPSR, where epistemic injustice occurs. Challenges of valuing the field, of setting priorities for it, and of funding it, to be honest. Challenges that continue today. In terms of our research focus, I think we've not done so well actually on the P in HPSR, even though it is there. And there's been some stagnation, I would argue, of the systems lens that was very much a part of the field, but that we haven't further developed as much as we could. It amazes me that in a system that is comprised of people, we perhaps have not done all that we should have done to think about the many facets of human resources for health, development, and management. And the equity focus of our work is sometimes more implicit than explicit. And we continue to have a dominant healthcare rather than health focus. In terms of capability, we've also had a field that has been dominated by researchers rather than our colleagues and allies and co-creators in the broader practice world. And often it's been dominated by researchers based in higher income countries. It can be a fragmented field. There are multiple smaller groups within it, and there is this fragmentation between the research and the policy and practice world. And developing critical masses of those in countries responsible and doing embedded HPSR, that's still a challenge that we have to confront. There are few such critical masses. And as everybody knows, I'm passionate about education, and notwithstanding what we've done, there is much more to be done in developing educational capacity around HPSR. So this is a very changed world. It's a confusing world. Some would say it's a Barney world. We used to be VUCA, now we're Barney. Does HPSR still matter in this world? Well, no surprise that I say resoundingly, yes. First, because the drivers of its emergence remain ever more relevant. Collective action for social justice matters. It always matters. We need to do all we can to support that. I also think that many of the HPSR focal areas are of enduring relevance, and I'll come back to that. And whilst we've established some footings for the field, for sure, those footings are in place to be built on. We need to continue the work of developing and reimagining the field moving forward. When I think about the variety of new challenges facing health systems globally, there are many things we can think about, from climate change to AI, social media, responding to the challenge of NCDs. And of course, they're not all listed here. But when I look at those challenges, what I see is that they focus attention on some of the enduring challenges of health system development everywhere. We need to strengthen and understand forms of governance. We need to strengthen system leadership, leadership of and for the system. We need to continue to evolve policy and regulatory frameworks, build resilient and responsive systems, support innovation, definitely focus on service delivery transformation. And we need to continue to work to understand and develop global action and solidarity in support of the enduring challenges and addressing the new challenges. So looking forward, what sorts of things could we be thinking about for HPSR? And remember that I'm, as I've already said, presenting some personal reflections, the things that I feel matter for the field moving forward, but others will have different views, and all views are welcome. I want to present 3 ideas. The first comes back to the P in HPSR and the need to recognize that the research that we do around the P, it matters because it helps to think about how to navigate the politics of health itself and health system development more generally. So what sort of P work can we do? So we're already doing, and we recognize the need for a focus on the political economy of various forces that shape health, health systems, health challenges, and health systems themselves. And they are global forces, and they are national forces, and they are local forces. But I would argue we don't only need to do that. Political economy of those issues is very important. But I would also suggest that we need to focus attention more as a field on political and organizational analysis that addresses the politicization and weakening of the public sector and regulatory bodies as the core groups that should be coordinating a collective response to health challenge. We need also to be thinking about the routine, centrally directed organizing processes of every system that influence collective practice, from public financial management to human resource management and supply chain management, for example. And thirdly, we need to think about how to navigate the organizational phenomena that really do directly impact on collective practice at the front line, at the local level. Phenomena like governance structures, but equally organizational cultures that shape professional barriers and the ability to work across those barriers. Secondly, I think that we need to do more to think about and support the emergence of resilient human learning systems for population health and well-being, strengthening local level learning networks, addressing local level health needs, engaging multiple forms of knowledge workers. And on this slide, I've tried to emphasize that in that task of strengthening local health systems, it's certainly important that we think about service transformation and quality improvement in healthcare. But really, we also have to, even to do that work, we also have to think about strengthening the organizational and multi-level system capability that enables service transformation. And critically, we need to think about the organizational and multi-level capability that supports local level networking. And on this side, I've called this whole system transformation. And I judge that it is rooted in cycles and processes of local level action learning in which researchers have an important role to play, but for which researchers are not the only knowledge workers, because people who work in the system and use the system have the most valuable knowledge. Thirdly, it's absolutely essential that we strengthen and focus our work on health equity and social justice within HPSR. It's part of our being and part of our essence. At this time, as like no other, we need to deepen this work. There is work to be done in measuring and assessing various forms of inequity to focus attention on the need for decision-making that promotes equity. But we also need to support equity-focused action by co-creating, sustaining spaces for voice and collective power in local networks, through local networks. And as researchers, we need to express allyship rather than drivership, if you like. And we have much to learn from the existing experience of so many communities who have sought to do this over the years. So then let me turn, lastly, to thinking a little bit about strengthening HPSR capability. And the points I want to raise are very much in line with the types of focal areas for HPSR that I've already identified. Certainly, as researchers, we always do need to think about our research approaches. And in this field, I think we need to re-energize our work to develop context-aware and sensitive learning and action. There are a range of participatory processes in which many people have been involved. We need to bring that different experience together to learn from it, to deepen it, to develop theory through the practice of learning and action to apply existing theory to that practice. And I feel we need to start looking much more outside the health literature for the sorts of theory and experiences that can guide us in this work. And let's all be more reflective as we work in the field. We come from different knowledge bases, all of us. We must act as boundary spanners to bridge the various knowledge bases to strengthen the field. And lastly then, at a local and a national level, I think it's really important to come back to that idea of critical masses of embedded HPSR, collectives or communities of practice that cut across the boundaries of research and practice of public sector and private sector and civil society, and to develop those collectives of those communities of practice. Educational system, health system interface is very important in this regard because it is in part through the educational interventions that we can develop those with the skills, competencies, mindsets to work in all parts of that field. And at a global level, talking to the Alliance, talking to Health Systems Global, I think that there remains and is important space for proactively, deliberately, purposefully, curating spaces of debate and dialogue across the linked communities of researchers, and most critically, between research, practice, policy making, civil society, to deepen the ideas, the practices, and the action so that the future is a better place than where we are currently. Thank you very much.
Thanks so much, Lucy. We couldn't ask for a better person and a better overview of both the strengths and the achievements of the field, but also its limitations and where it hasn't quite realized its mission or its potential, and also a reflection on this moment, your strong commitment to the values of the field and that need to make a difference is always inspiring and a really important reminder in this period. So thank you, Lucy, but we're now going to have a further discussion. And so let me hand over to Aku Kwame, who I introduced previously, who is going to run the rest of the session. So over to you, Aku.
Thank you very much, Kumanan, and colleagues. Good morning, good afternoon, good evening. It's wonderful to have the opportunity to convene like this. We have just under 300 people online, so hello to all of you as well. Before I introduce our very esteemed panel, I do want to remind colleagues online that we do have the Q&A open. There are some questions there already. Please do put your questions in. We've saved sufficient time to be able to have a very vibrant dialogue today. And Lucy, thank you so much for your really articulate presentation, as always. So Lucy spoke to us about where the field has come from, and now we're going to move into a panel discussion reflecting a little bit on where the field is going. And so let me introduce our esteemed panelists today. First, I'm pleased to introduce Dr. Rashidatu Kompaore, who is a public health physician and a research associate at the Institute for Research in Health Sciences, that's IRSS, in Ouagadougou, Burkina Faso. Rashidatu specializes in the implementation of health interventions, particularly around maternal and child health and malaria control. Next, I'd like to introduce Professor Fadi El Jardali, who is the founder and director of the Knowledge to Policy Center at the Faculty of Health Sciences, the American University of Beirut. And he's also the director of the WHO Collaborating Center for Evidence-Informed Policy and Practice, and many more esteemed titles that Fadi holds as well. So Fadi, welcome. Next, I'm pleased to introduce Dr. Keith Klute, who's the head of health for the Western Cape government, a position that he has held since April 2020. And prior to this, he served as the Deputy Director General, Chief of Operations for the department from 2015. Dr. Klute has a medical background and has worked in various leadership roles within the Metro of Cape Town and also with the province. So Keith, we're glad to have you here. And last but not least, I'm delighted to introduce Professor Joran Thompson, who is an affiliated professor of international health systems research and a member of the Health Systems and Policy Research Group based at the Karolinska Institutet in Sweden. And Joran, as many of us know, has played a key role in the founding of the Alliance and also in guiding it by being a member of the Scientific and Technical Advisory Committee for many years. So Joran, welcome. So before we open up to the panelists, we have some specific questions for all of you based on where you sit in your own health systems, in your own research systems. But I thought I would give you each an opportunity just to give a 1-minute reflection on maybe something that you heard from Lucy's presentation. Lucy spoke to us about the foundations of the field, that health policy and systems research has always been a field of action and collective action. We looked at the evolution from the milestones to the challenges and limits of the field. We all, I think, agree that health policy and systems research still very much matters based on some of the drivers that we're seeing in the global system, some enduring challenges that we continue to face, and really a preoccupation around sustaining the gains made so far. And then looking forward, how do we think through the P at multiple levels, with multiplicities of knowledge and multiplicities of capabilities as well. So Fadi, I wondered if I might start with you with just a 1-minute reflection on what Lucy has presented to us. Thanks.
Thank you so much, Aku, and welcome everyone. Thank you so much, Lucy, for the excellent presentation. Also, more of a good articulation of some of the discussion we had over the last 2 days when we're really talking about the new frontiers in health policy and system research. Now, as you all know, that we're living in a new world order, and where we see a lot of interconnected challenges and much more wicked problems that requires action, requires solution. And I think, you know, and I think it's a good reflection, Lucy, what you have showed us, that if we want to see forward, we have to look backward. And it's good to actually take stock of all what we have actually had achieved so far, and at least in the last 2 decades or so. And we have seen a lot of trends, we have seen a lot of patterns, but now we're seeing also new trends and new patterns. And the question really how ready we are to actually go and actually engage and address some of those challenging problems. So excellent articulation. I think one, maybe I would say, I would put 3 questions, just more of a, to reflect on it. The first one is that I think for the health policy system research community, I think the first question, you know, to what extent we're conducting health policy system research to address complex problems. That's first. The second question, to what extent we are actually utilizing, harnessing, leveraging on theories and framework and concepts that goes beyond the health sector to actually address particularly intersectoral issues. And the third question is the so what. You know, are we actually looking at the impact? And I know, Akko, that we're going to be discussing about this, how we can make sure that, you know, the whole world does not only know about what we are good at, but also what we are good for. And I think the question really, are we providing also actionable solution to address this problem or interconnected problems, wicked problems, so they can look at us as a community as a problem solver as well, not only just unpacking problem and understanding underlying causes, and also having convening power. So this is just some thoughts, and I think what Lucy's presentation gave us a little bit more, some, you know, good structured approach to how we reflect on what we have actually achieved so far as a whole community, but also, and I really underscored and emphasized that we are now under not only in a challenging world, but there's a lot of new possibilities, a lot of new opportunities. We have to look at it in a positive way, and the health policy and research community has an extremely important role to navigate and to create the new possibilities and to actually create the future we would like to see in the future. Thank you.
Thank you very much, Fadi. Rashidatu, I wonder if I might come to you next.
Thank you very much, Aku. It's a very great pleasure to be here in this panel with you all. We are currently navigating a very fast evolving landscape that presents a lot of challenges in HPSR. Reflecting as an HPA fellowship program for the Alliance, and also for having contributing to the CRESPA program that was meant to build the HPSR capacity for mid-level career professionals in Francophone countries with the Alliance. I take this opportunity to thank my mentors that are here, Lucy and Aku. I want to give some reflection on how we can leverage on these challenges to contribute in training in HPSR. I must say that a lot has also already been done, but we still need to tackle disparities in regional capacities in HPSR, such as in country regions like Francophone and Lusophone settings in Sub-Saharan Africa, for example. And also, not only the regional disparities, but we also need to build capacity within different disciplines of researchers and different categories of actors, such as researchers and policymakers and also civil societies. We also need to develop meaningful mentorship models and also foster mentorship, local and regional networks to support alumni in leadership to address current and also future challenges in HPSR. We also need to encourage practice-oriented research that aligns with priorities in local priorities and the realities of local context. We also need to engage local champions in HPSR that will foster institutionalization of SPSRs. This will help in embedding HPSR curricula within existing training programs. It will also help create knowledge sharing platforms that will help collaboration within researchers and policymakers. And it can also be a way to advocate for local institutional financial contribution to HPSR, which can facilitate for appropriation of research findings also. Finally, I think that we can also leverage with innovation in digital and AI innovation to foster learning about emerging issues and also emerging topics, though we still need to have an eye on regulations for ethics and equity. Thank you very much, Akko.
Thank you very much, Hashidatu. Keith, I wonder if I can come to you next, please.
Thank you very much, Akko, and just to reflect my appreciation for the manner in which Lucy has shared her experience with us. It's always good to learn from somebody that through practice have accumulated wisdom. And when she shares it, what does it mean to each one of us? I think there's 3 points I would like to make. It was really good for me in the last 2 days to have a reconnection with an essential purpose of why we do what we do. And it's really talking to that common set of values and believing that collective action and achieving equity is why we do what we do. The second thing for me is this is a call, this moment in time in history is a call for bold and brave and fearless leadership. It's a time to stand up for what is right and for what we believe in. And I think this is an opportune time for, in this field, and everybody to come together to stand up for what is right and do the right thing. And then lastly, now more than ever, that the way we address what we need to do is through coalitions, is through wide collaboratives. It's taking everyone along. And it's really building bridges rather than separating people. So I think for me, Lucy's reflection really takes us all at a place to say, we commit to something to make the world a better place. Thank you.
Thank you very much, Keith. And Euron, I wondered whether we might get your responses to Lucy's presentation. Thank you.
Sure, let me start by acknowledging that we have 300 listeners on the webinar. I'm sure many of you are future champions. That has been capacity strengthening individually and institutionally has been at the core of Alliance activities. I'd like to congratulate you, 300 and all in this room, Lucy, of course, but everybody is congratulating Lucy. And she's worth it. But it's important also with the new generation, huh? And there is a title, Aku, of this session, isn't it? Something like, where is health policy systems research going? Or is it going forward? And I can reassure everyone that it is going forward stronger than ever. I've been around for 24 years or so in different capacities, as Aku said. And some of the stuff are still valid. Huh? I'm sure all 300 have read this excellent product of the Alliance, edited by Lucy, the reader in health policy and systems research. It's really good. I use it at Karolinska Institutet, a very prestigious Nobel Prize giving kind of conservative institution. There are also new challenges, as some alluded to here. Crises are also opportunities. Just look at how COVID-19 made many decision makers understand the importance of functioning health systems. And they themselves need evidence. And that's what health policy and systems research provides. The new crisis we have now is a new world order, the geopolitics, shutting down of US aid responsible for 48% of not WHO budget, fortunately, but humanitarian aid, which might be even worse. And many, many other things affecting health workers. The closure of PEPFAR, what is being done with USAID. But maybe this also presents opportunities. There's a need for new ideas, innovations, new research questions in good collaboration with equitable partnership. Networking is surely another strength of this excellent secretariat, the Alliance. I will come back to that in the next intervention, but I will finish with how I started. Congratulations to those of you that are listening. This is the future. Thank you.
Great. Thank you so much, Göran, and thank you, everyone. So I think let's go a little bit deeper now. And Keith, I want to start with you because Göran has alluded to the volatility in the current climate. And so, Keith, can you share with us a little bit about the volatility and about the uncertainty as a policymaker? How do you navigate your changing contexts and speak to us a little bit about the utility not only of research and data as researchers often think about it, but maybe broader concepts around knowledge and practice as well. Thanks.
Thank you very much, Aku. I think many of us have shared that the world is a brittle and anxious place. The life of a policymaker or the daily experience of a policymaker is that you experience all of those. And many things that comes at policymakers, I would have three broad things that comes at them all the time. The first thing is that there's a very strong log frame reality that boxes policymakers in. It comes from various places, but your world is reduced to accounting for what you have to do in very, let's call it simplified and reductionist approaches. That reality is a combination of two things that goes with it. And the first one is resource scarcity, which then leads to the fact that you feel under pressure and you feel you are kind of dealing with what I would call a scarcity mindset. And coupled with that is the need in the short term to find solutions. So the world is speeding up for policymakers. And it takes us, a policymaker, much more into a reactive space, not of the policymaker's own doing. That is what a system has created. Now, the challenge is for policymakers with that reality coming at them to find the space to reflect, to find the place to intentionally shift daily practice of an entire system, to find the place to move from a scarcity mindset to an abundance mindset or a collective mindset with others, to find the place to move from a short-term response to a long-term, medium to long-term orientation. These are not easy things for policymakers to do. And I think one of the big things that policymakers are called upon to resist is that all of those short-term measures, all of the quick solutions, all of the things that is almost telling them that this is the way of the convention that you have to solve and deal with your problems, are all counterproductive, because all it does, it makes the problem more acute. So you're stuck in a vicious cycle of shortism and of things getting worse. To break that practice, and that is for me as a policymaker where I found the greatest gain as part of this. The first thing of this field, what it's afforded me to do, is the tools for sense making. Because if you don't have the tools for sense making, because it's asking the question, and it's a fundamental question as a policymaker to survive in this world, is actually to be curious and to understand why things are the way they are. So asking questions, being curious, these are the tools that comes with reflective practice. But more importantly, what comes with this field of me connecting into the field is also the tools of shifting daily practice. And it's in the face of this where the opportunity presents itself, where you can say, I can continue to do what I'm doing, and my situation will just get worse. And then I move into crisis management all the time. Or I can take an intentional step to say, hang on, I can stand back, I can think, I can tap into these resources, and it helps me to make sense so that the practice is intentionally to shift this. And all that practice means is a kind of intuitive thing. The stuff that's coming at us is so complex, no single person is going to solve it. So the issue about power, to say, I've got the power to make the decision and therefore I'm going to solve the problem, the further you are away from the problem, the worse is your possibility to actually make a right decision. So it's counterintuitive to say, I must make a short-term decision, because actually I need to go to the people where the problem is, I need to empower them. So it's these counterintuitive things. Instead of centralizing, decentralize. Instead of pulling back, give people autonomy, let go of power. And it's these kind of practices, which I think is probably what this field offers. And I believe there's more policymakers ready for this than continuing to do what has brought us to the situation where we are. Thank you.
Thanks very much, Keith. Those are really interesting reflections. Fadi, I'll come to you to pick on some of those threads. You have worked a lot with policymakers in your region as well, and a lot of your work on supporting evidence-informed decision-making. Within the field of health policy and systems research, one of the measures that we hold ourselves up to is how much our research actually influences policy, how much transformation is evident from the knowledge we generate. So I wondered if you might speak to us a little bit about impact, and particularly the challenge that we face, which is that many of the things that are important are not always the things that are countable. So how do we articulate that value? And yeah, how should we be thinking about impacts going forward?
Thank you, Aku. And I have to say that, over the last several years, we reflected a lot, particularly in the space we work in, because we do a lot of work with governments, with policymakers, and with different players in in the health sector, and I thought that maybe I would reflect a little bit on that experience, but also, maybe put some thoughts for discussion and a call for action when it comes to how we think about impact. And I believe all of us in the health policy system research community would like to see impact, would like to feel that we are really actually bringing value, we're making change. And we are always challenged by this question, can you tell me what type of impact you're doing in terms of the research that you're producing? And I think is that sometimes quite challenging. And so if we think about impact to see direct correlation with policy change, unfortunately, we're setting ourselves to failure because this is not how we look at it. We know that policy change is complex, multifaceted, sometimes slow, and a lot of attribution that come to play. So basically, that's create a lot of paradoxical, or a paradox in terms, policymakers wants evidence, but we can't clearly show the impact. So how we can really make better use and value of our engagement as health policy and system research. I think this is a key question. So meaning how we can rethink, impact in a way that actually strengthen rather than weaken our contribution. I think this is very important. It's a question I think we need to all ask, and we're asking also at the American University of Beirut and the Knowledge Processing Center, are we actually chasing the wrong indicators when we actually think about the impact? And I think this is important. Maybe we need to reflect in a way, particularly with the, that health is shaped by factors outside the sector. So I think that's the reality. And it took us a little bit more to rethink about this. And there are three things maybe I will put forward. The first one, that maybe we need to rethink of a nuanced framework that can measure impact in health policy and system research. So we need to get better at measuring policy impact and not to abandon it. So I think it's very important. So how we can really capture, we need to think about innovative impact measurement approaches, maybe, a new framework that look at short-term, long-term effect. Utilize different type of, quantitative, qualitative measures, but also move beyond the traditional metrics. I think this is very important for us. Instead of asking, did we make a change in this policy? Maybe we should ask, did it shift the policy conversation? Did it create a new policy narrative? Did it shape the decision-making processes, particularly the P part of what Lucy mentioned? Did it empower new actors in policymaking? And also, and we have a lot of examples that this is happening actually, but sometimes we're not measuring it. This is what I'm trying to actually come to. So basically, how we can really enhance the integration, embeddedness of our findings in decision-making processes at multiple level. And this is very important about we need to better understand the process, and we mentioned this today, the science of engagement, because this is very important, and we need to start getting better at measuring it when it comes to our work, because we do a lot of work in that space. The second point is that, again, if we're talking about interconnected problems, interconnected world, absolutely, there's interconnected impact. And I think this is really where if we need to position health policy system research in the multi-dimensional, intersectoral type of dimensions, linking health with climate, with education, labor, social protection, you name it, we have been focusing a lot on the ministries of health. And I think they're doing a lot of great work. They have their own challenges, but I think we should not really ignore the powerful forces that shape health. So we're really talking about financial policies, trade policies, social environmental factors, private sector. Much of the innovation now when it comes to health system financing or health service financing and delivery is actually coming from the private sector. So we need maybe to rethink about how we can better engage, how we can have alignment of values with the private sector. We need to have a broader impact that look at the influence of our work, how we shape how the industries, how we can understand the market, and how we can really better show value of this. So that's why we need to invest in impact beyond us as health policy system research community. We need to invest in institutions, in systems, in processes. And this is really why it's important. And I think, part of the measurement we need to think about, how many health policy system research trained decision makers are working now in government, in countries? Whether countries and government and ministries have embedded and institutionalize the use of evidence in decision making. So this is an important question to ask. How well health systems to adapt to crisis? How much they are resilient? So we are creating, we need to create that space for those type of questions to be this. So let me end by just more of a, I would say, call for action. Again, this is reflective from work that we have done over the last many years. How we can think about a different approach and stronger approach to actually impact. So, meaning, if we talk about efficient, smarter approach to impact, meaning we need to measure policy influence more effectively rather than abandon it. We need to rethink about overarching framework. We need to recognize impact beyond just policy. We need to look at it from a governance perspective, in market, in social system, and we need to invest in institutions and people. So it's not really, going back to the question, Akko, impact is not really about a direct correlation, whether there's a policy change tomorrow or not. We'll never see that. We'll be frustrated and we're setting up to failure. It's about whether we are building the knowledge, the systems, the institution, the processes that drive long-term sustainable change. Thank you.
Thank you very much, Fadi. And I think, Joran, you wanted to respond to something Fadi has said.
Not necessarily, so maybe I should keep quiet. I wanted just to add on a few things, if I may. I want to return to the human dimension. I mean, there is a risk, obviously, with the complexities and systems and policies. But never forget the importance of champions. And thanks to the fact that Lucy won the Virchow Prize, note how to pronounce Virchow. Our area was recognized globally beyond our already established friends. Very important. Rudolf Virchow was a German physician, generally regarded as the greatest pathologist of all time. He lived in the 19th century. But he was not only a pathologist, he was also an anthropologist. He coined the term zoonosis, so important today with pandemics. Did I say he was an anthropologist? I probably did. He was so many things. He was also a public health activist, okay? He founded what became social medicine. And can you guess how he ended up? As a politician. Quite interesting career, trajectory. And maybe something that some of the champions will follow. Now, in the meeting we had, very enthusiastic meeting, I read a quote, and I will do it again for those that did not participate. It's from the anthropologist Margaret Mead. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And with this, I'd like to acknowledge the excellent work done by the Secretariat, but also throughout ideas for those of you listening in the webinar. Don't underestimate what you can do and what you can achieve. Good luck with that. Thank you.
Thank you very much, Joran. So Rashidatu, speaking of the human factor and the future champions, I want to come back to you, particularly around capacity strengthening, teaching. You're an educator and you train. You're training the next generation of health policy and systems researchers in Burkina, but you are engaged in regional networks as well. So can you speak to us a little bit about some of the changes that you see in many of your students in terms of, are you seeing a change in profile? Are you seeing an increase in demand for health policy and systems research training? Do people graduate and end up with jobs? And how do you see some of the global shifts that we're currently facing having implications for you and the students that you're working with?
Thank you very much, Aku. I think that in our context, a lot still needs to be done. We are not favored because we have this language barrier, and we are struggling to access the resources. We are struggling to access meaningful teaching, and to bring these new approaches in our how can I say it, traditional way of teaching is still a struggle. So we are advocating in incorporating HPSR approaches such as system thinking, and also knowledge transfer within the way we are teaching our students. And it's starting to make sense. It's still not there, but we see it in the way the participants, the trainees are reframing their questions, and to make sense of the local context and priorities in their approach, and also the approaches, because usually we used to have this many of people used to, our trainees used to have this biomedical way of approaching their methodological questioning to their research, but more and more they are incorporating a multidisciplinary and trying to make very nice reflections, since to have an ecological approach to the issues. So I think this is a good start. And we are also trying to dynamize our networks, local networks, and we still need some push-up to have a good collaboration within the regional networks, but we are still continuing the reflections. Thank you.
Thank you so much, Rashidatsu. That's a really encouraging reflection about how health policy and systems research is taking traction. And what you said, it's reframing the questions, the priorities, and the approaches of your students. So that's wonderful. Thank you. Thank you, panel. So I think we're going to now shift into the Q&A moment. There are already a host of questions online, and I'm sure that there are some questions in the room. Lucy, we will draw you back in at this stage. So I will do my best to go through some of the questions and throw them out across the table. And I do apologize in advance if your question is not read, but we'll try to synthesize it and cobble them a bit together. So Lucy, let me throw you the first question. It is a question around being systemic and taking a systems approach, and yet dealing with misinformation. I think this is touching on your point about remaining politicized and understanding the politicization of the public sector. And so how do we do that, maintaining evidence when we're battling things like misinformation and often the conflicts that arise due to politics?
Great. Well, thank you for that very difficult question. I guess I'm thinking of the slide it might have been generated by, and forgive me if I've got that wrong, but I think that I was imagining that some of the challenges around information and disinformation are linked to issues of lack of trust in some of our traditional institutions, which would include the public sector, and that therefore it's important to understand what generates that lack of trust, and to then work out how to strengthen. It might be the public sector, it may be other institutions, old style media perhaps, in ways that actually work to build trust within societies at large. And I think that is a systemic lens. I think the systemic lens requires us to think about the ways in which significant societal challenges infuse into the terrain of work of health systems and health policy change, and then we use the systemic lens to think about, well, how to build better, build back relationships, for example, in ways that allow future action. But others may well have much better answers. So I could please throw it elsewhere as well.
Thanks very much, Lucy. I'll take that question and I'll add on to another question. It's related, and Keith, let me bring this one to you. The question is so building on the idea of social justice movements and trying to understand the actual translation of research and engagement with policymakers. The idea that high quality health policy and systems research does not always translate into action and uptake. So from your position as a policymaker, can you reflect on that?
Thank you very much, Aku. It's a really interesting question. Part of our deliberations of the 2 days has been what this field has got to offer for social movements, for social justice. I made the proposition that I believe that being able to have a deeper understanding and to do more sense making, and then to consider your options of how you respond to the situation that you face is offering a solution. Because part of the problems that we have is whatever we've done before has not worked well. So part of understanding what social movements for social justice actually require is understanding the deeper dynamics of where mistrust comes from, the deeper dynamics of where the connection between people have been lost. It's all of those dynamics. And I think what the field has got to offer is, let's call it a theory lens that gives you a much broader array of things to try and make sense of the conditions that you're dealing with. Besides the fact that there's a strong focus, and there should be a strong focus, on the practice of building coalitions, of hearing different perspectives, of bridging differences of opinion, and getting people to understand the problems from multiple perspectives. For me, in this current reality where we are of complexity, that is a solution. I think people have maybe a mistaken idea. I've got a problem and I need to have a simple solution and I need an answer tomorrow. What this fields offer is to say, let's live with the problem. Let's bring everybody's experience to the fore. Let's share common understanding. And out of that, let's have collective action that takes us into places which we cannot predict. But in that process, you build ownership. You build a commitment to co-creating. You build a commitment for social solidarity. For me, that is what social movements are all about. And I think there's very few fields that offers that sense of a collection of tools and approaches that helps us to take the process forward.
Excellent, Keith, thanks so much. And I'll also invite the panelists if they want to add on any of these reflections as they're coming up. But Joran, let me come to you next. We have a question here from the Democratic Republic of the Congo, asking specifically on the issues of the polycrisis. And how does health policy and systems research move forward in the context of polycrisis? So I think you have some opinions on that.
Thank you. This was also a difficult but extremely relevant question. Okay. It so happens that I prepared for a presentation I made in Sweden about a week ago, reading the history of DRC with so many challenges. Huh? I'm not going to repeat all of them. But I feel extremely humble to come up with a suggestion how to deal with the polycrisis in a context with so much suffering, so bad politics, and so much of power games, and a history of terrible colonization. So I'm humble. Now, never give up, as Churchill said. And it happens that the Alliance, together with a few of us, published a couple of years ago under the leadership of Aku Kwame, a paper on the syndemics and how to use complexity science and systems thinking to better understand the relationships between climate change, COVID-19 and other pandemics and conflict. But this is just a beginning. We have to remember that our field is quite good at diagnostics, good at describing issues. We're not as strong as coming up with good prescriptions how to solve the problems. But if I may, I don't know, Aku, if I'm allowed to say this. You can shut off my microphone if I'm not. Yeah, no, not you, Lucy. I would like that the person that asked this question communicated with you, Aku, and that we follow up. Also that you send our paper, and maybe the person that, the most important thing in health policy and systems research is to ask the right questions. That is key to good quality science. And this was a good question, and we would like to follow this up. And if you communicate with Aku, we'll see how we can do it. Thank you.
Thank you very much, Johan, for the answer and for the invitation. We have a question here, and Fadi, I'll come to you. The question focuses on co-construction, co-production, and trying to understand marrying rapid synthesis approaches with the realities of decision-making, as we've heard very eloquently from Keith, and as you, of course, know. And so the question is really about balancing the tensions between trying to be rigorous and scientific with, of course, the mismatches in time and incentives and interests.
Thank you. This is a very good question too, and I think one of the maybe learning that we had from COVID-19 crisis, that in fact much of the decision needed to be made in real time, and I think they put a lot of significant challenge from the demand side, because there was a lot of demand for best available evidence, high quality evidence to address particular areas and intervention related to how countries dealt with COVID-19. So from that experience, and I have to say that for the health policy system research community, we should be ready for this type of asks, for this type of demands from decision making, if we actually want to be the go-to community for a trusted community for providing real-time evidence at the time of crisis. Going back to discussion about the polio crisis, I come from a region, fortunately we have a lot of overlapping crises. We've learned to do this the hard way, but at the same time we've actually built a lot of capacity of doing this. So we actually, since COVID-19 now, we have a rapid response function within the Knowledge Top Policy Center. And we have a lot of capacity because everything is based on a standard operating procedure. We don't compromise the rigorous type of evidence synthesis because we want to respond. So now if you look at the science of rapid response over the last few years, when it comes to knowledge translations, there has been significant improvement as well of how we are preparing a rapid response document. There's different features for those documents. And I think there's fascinating work that has been done by many people that are actually working in that space, also from McMaster Health Forum, that they are Oculopaedic Center as well when it comes to rapid response service, among others. But we have learned over the last a few years how we can do this better. And to be honest with you, it's very much welcome now in the policy making community. We were able to change policies. We were able to actually stop laws. We were able to draft bills we were able to actually create programs from those rapid response, service. So what I would say that, if you're not ready to do it, don't do it, because there's a lot of shortcomings to that and a lot of limitation, and you don't want to lose the trust of the community. But I think what I would say for the people that are working in the evidence synthesis space, people always looking at the pre-appraised evidence that is synthesized, packaged in a user-friendly way that is actually also brought to the table of the people making decisions in real time. And I think building more capacity in that space, being ready for those type of asks, because you can have a huge opportunity to make impacts if you have this type of capacity. So I wouldn't say we are compromising rigor versus rapidity of response, not at all, as long as you have established features and you're going within really how it should be done, and acknowledging the limitation and being transparent about what this product is and what this product is not. And I think this is very important, so people can really are aware before they make that decision.
Excellent. Thank you, Fadi. So let me come to the room. I know that we have one question, and let me just see if there are any other hands as well. But Sarah, maybe you can introduce yourself and pose your question.
Sure, thank you. Sarah Dalglish, HPSR researcher and director of Children and All Policies 2030, a consortium of researchers and policymakers working on child health. First of all, thank you so much to the Alliance for this fantastic event with a really smart and well-balanced panel. It's been really fascinating to hear you all speak. My comment goes back to a point that, or question that Lucy made in your presentation about how HPSR has traditionally focused arguably too much on health services, not enough on health, and how that relates to a comment that you made, Keith, about the policymakers' experience of often having limited decision space and sort of being in a mode of reactivity. And at Children and All Policies, we have part of our mission is to have a holistic view of child health. And we have found some strategies to address disciplinary boundaries amongst researchers and sectoral boundaries amongst policymakers. But it's so difficult and it takes so much energy to do so and to break down the way the world is kind of organized right now. So I just wanted to ask, I think it's a really important point about the future of our field, and it goes back to some of the social justice issues that are at the core of it. But I was wondering if you or anyone else on the panel had any ideas about specific strategies to addressing that recurring problem. Thank you.
Thank you, Sarah. Keith?
So Sarah, thank you very much for that question. I mean, part of what I started with, which was connecting with purpose. I have a very strong sense of child well-being, and Children in All Policies is a very key driver to that. So part of the point I made, and a part of the point that Lucy made, is log frame thinking and making child health a programmatic approach has been one of the most difficult things to break out of, and that's what you're experiencing. Because if we have reduced child health to a set of indicators and a set of interventions, and that is kind of health system owned, which is health service owned, the moment you start talking about well-being for children, you're completely lost in terms of trying to convince other sectors, which themselves also have received their little piece of the log frame thinking, which in social development is about child protection. Or the other one got it for child nutrition, or that one's got it for this. And part of the challenge that you have to then almost flip on its head is to resist the log frame thinking. And that's where the leadership comes in, to create a space where people can come forward and step out of the silo. And it's a galvanizing thing when you say that you connect with the well-being of children. So I, specifically in the local setting that I am, we currently driving a very, very progressive process for that. It's got academics, all the academics working with us. We're looking at new measures of success, new ways of actually tracking what well-being means for children. We got all government departments, we got civil society, we even got business working with us. So there's many innovative ways that once you've created this space where people say, let's think transformatively about this. And in a sense, let's suspend our conventions of where we come from. We have a collective goal. From there, it flows. So there's a lot of exciting work that can be done, but it is breaking so many different conventions. So what I used in our last 2 days is the analogy of the iceberg. Because in a sense, what's above the iceberg, what's above the sea is, let's call it these conventions that constricts. It's when you go below the iceberg where HPSR steps into its own. It's about understanding underlying systems. It's about understanding relationships. It's about understanding systemic approaches to actually address the bigger issue. Thank you.
Thanks very much. So Lucy and then Joran.
So thanks so much, Sarah, and nice to see you. I just wanted to add that it seems to me that that act of breaking those boundaries, of creating the space of collective engagement, is itself an area where our field, health policy and systems research, can help both to engage with how that might be, but to track, document, and measure impact from that, if we understand impact differently from the norm. And so I think there are many areas for our engagement in better understanding the ways in which networks can cross boundaries in order to focus on common goals.
Thank you for a very good question, dealing with a very interesting and important area. Makes me think of that we haven't talked, not even the last 1.5 days, on very much on Agenda 2030 and the 17 SDGs. This has very much to do with that. If you're interested in it, you can find a paper in British Medical Journal 5 years ago where we put child health in the context of SDGs and Agenda 2030. This helps with the diagnosis, not with the prescription. But fortunately, we had another paper a couple of years ago by Kent Buse et al. I was part of it also, where we looked at empirical data of barriers and enablers. It was not focusing on child health, but I think it's quite generic. That's an interesting echo. And I think that might be something. On the other hand, I don't know about your situation when it comes to funding, etc., but this is, of course, an absolutely essential thing for progress. So thank you for the question.
Great, thank you, everyone. So, of course, as usual, there's not sufficient time. So I'm going to give each of our panelists a 1-minute reflection, but let me try my best to summarize some of the questions we could not get to, and invite you to, in 1 minute, if they're one of those that you wish to respond to. And again, thank you, everyone who has submitted questions and comments. So there are some questions raised around the current global health context, issues of nationalism and globalization, and of course the issue of funding for global health, and in certain areas, the reduction or the erosion of democratic ideals. What is the role of high-income countries and high-income country partnerships in equity? Another set of questions around how do we continue to advocate for universal health coverage and health system strengthening, and how do we engage with different kinds of actors, so informal actors, but then also specific communities, the medical community, the citizen science community. How are we approaching team-based practice in terms of translating that and drawing on different epistemic backgrounds? And what are the strategies that we are continuing to use to build critical masses of health policy and research, but also non-research actors? When we think about the pushing back on the short-termism that was raised, what are the implications for that, particularly in engaging with senior politicians and policymakers when there's sometimes no appetite for longer-term engagement? And what thoughts do we have on health policy and systems research in emergency settings, and around networks for junior researchers? Let me finally just say that there was also a lot of praise, Lucy, for your presentation, and ideas around continuing to think outside of health, continuing to strengthen our resolve, and then also praise for the continuing simplicity of the health policy triangle, Lucy, which people are still using in their teaching. Rashidatu, why don't we move down the table? So Rashidatu, why don't I come to you, and then Keith.
Thank you very much, Aku. I would like to react on the building critical mass of HPSR capacity strengthening. What I want to say is that I was reflecting on what one of my colleagues was saying last week when we had a meeting on reflecting of current and future challenges. And she said that most of what we do, we are already doing HPSR without knowing it. So what we need is to demystifying the field, the term, so that people understand better and they could understand and adopt better the theories to what they are doing to their daily basis practices. So I think that through this approach, we can have an understanding and collaboration between researchers and also policymakers and practitioners in the field, and this can yield better results. Thank you very much.
Thank you. So, I mean, in conclusion, I think the HPR is, if you are, or HPSR, I get it wrong the whole week, Lucy. I think if all of us in this coalition, which is guided by social justice and equity, taking whole system approaches for understanding what is required to address the issue of social justice and inequity, you cannot other than say that this field is custom-made for addressing those things at scale. And from a context of living in a country where inequality is massive, the social determinants of health and well-being is so in your face. And I guess the ability and the constraint of coming at it in a very narrow programmatic fashion is not even getting you close to dealing with the root causes of doing that. And I think for me, one of the most powerful things of this field, it opens the space for people that are concerned about societal inequality to really use this field, what this field has got to offer, in the endeavors to really address the issue of inequality and inequity. Now, I think that is needed for the most vulnerable in the world. If there's one thing that we all get together around, is to recommit our, I would call, our ethical and moral obligation to look after the ones that has the most deprivation and underprivilege. For me, that is a key driver of why people should come together in broad social movement to commit and use what this field has got to offer in the best service of the people that need it most. Thanks.
Thank you. Fadi, let me come to you next.
So I think, I echo much of what has been mentioned. I think there's a lot of thoughts that one can reflect on, but just again, in 1 minute, I think what going back to what has been achieved over the last several decades, I think there is significant work has been done, significant contribution and good impact. But also there is also some unfinished business from the priorities that we invested research on, and we haven't closed the loop on it. So I think it's very important to, when we look backward, to see what are some of those areas, neglected areas, perhaps that we haven't really, maybe achieved significant impact on, and because they are still relevant and of priority, but at the same time also venturing into new opportunities and the possibility that the interconnected challenges that we are living in. I think there are the new areas that we need to actually get into the space, try to actually look at it from a from an interdisciplinary approach and maybe have an opportunity to contribute and to provide solution. But if you, in short, I mean, I always look at, okay, what health policy and research need to do at this stage. I think we need to amplify our work. We need to harness on all the existing knowledge and reduce knowledge waste. We need to empower our community and empower the people that we work in. And we're talking about beyond the research community. We need to leverage on the opportunity and the momentum that this crisis is also creating. And we need to make more and more and measure impact. So more fit for purpose work, but at the same time, we need to be perceived by the world as our contribution to be perceived of value, and at the same time of impact, and addressing some of the challenges and providing solution. I'm hoping, Aku, that much of the discussion, again, this is a very rich discussion, I have to tell you, in this session in the last 2 days, and I think we need to reflect more and more on that. But I ask maybe perhaps all the participants in this session and the people that join us virtually, is that we need to continue that conversation and reflection. And the Health System Global Society will be doing online consultation as well with all its members when it comes to what they would like to see for HSR 2026, when it comes to the SEAM, to sub-SEAM, to the type of engagement that this symposium will create. So I'm hoping we'll hear more and more from our community, more brilliant ideas about how we can take this conversation forward, and actually, collectively, going back to what Lucy mentioned, how we can enable collective action for a purpose and with an impact.
Great, thank you. Joran?
The times, they are a-changing, as Bob Dylan sang. And we need hope. There is no time for pessimism. Now, during the meeting that we've had, the director, Kumana, talked about excitement and enthusiasm. What is happening in the world now makes health policy and systems research top relevant. Top relevant. This means that the 300 or so participants have all opportunities to engage. And I have certainly been inspired these couple of days. So I'll end with a thank you.
Thank you very much, Joran. And Lucy, we give you the final word.
Thank you very much. I was incredibly privileged to be awarded the Virchow, I'm trying hard, prize last year. I think I failed again. Virchow. I saw that award as an award to the field. And I saw that award as an opportunity to rethink, re-energize the field of health policy and systems research. And I'd like to thank everybody who's been a part of the conversation today, because the field is the people within it, from all our different disciplinary practice walks of life. To those online who may be researchers, I want to absolutely encourage you to see this as a field which is a home, where there is a place for you, but also to encourage you to see research as moving beyond the boundaries of formal knowledge generation, to the boundaries, to cross boundaries, to mobilize knowledge with others, recognizing that all of those who seek to support health system development are knowledge workers. And we need, as a field, to encompass many different knowledge workers. There is research to be done on how to create spaces of engagement, of tacit knowledge gathering and application. So researchers, you have a role in this collective movement, but as researchers, we should not be boundary police people. We must rather be boundary crossers, and we must learn from those with whom we engage who are together so that we can together maintain a focus on social justice and health systems that work for everybody and for those who are most vulnerable. And I think that is a goal that Virchow himself would approve of. And I think it is something that places like the Alliance and Health System Global also seek to support. So to everybody, get on the train, it's moving, we're going forward. Thanks, Aku.
Thank you so much. I want us to briefly just give our panelists a round of applause. That was wonderful. Thank you. And I know that our colleagues online are clapping as well. And so Kumanen, we hand it back to you.
Well, as always, time is our scarcest resource. So thank you. What a panel we've had. Thank you to the quality of the questions. It shows the dynamism of our field. We're going to single out Lucy further and give her this woodcut of the Alliance logo after the event. It doesn't come with the same remuneration as the Virchow Prize. I apologize. But maybe just to say, well, I mean, everyone in this field is a giant. We also have members of our stack and other colleagues in the room who are giants of the field. It is a dynamic field. It is an exciting field. To finish, to try to frame the very rich discussion we've had today, 3 quotations from men of the 19th and early 20th century. Actually, I'm not sure why I'm doing that, but I'll keep going. Firstly, Lenin, in some decades, nothing happens. In some weeks, decade happens. And that's the period we're in now, a 1989-like moment. And so, yes, we should avoid short-termism, but people are not waiting to respond to this crisis, or all the crises. We convened as the Alliance with our health financing and economics WHO colleagues last week, countries and funders. And countries are not waiting for us to work out what should happen in Geneva or in New York, but either in research and academic institutions. People are moving, they are responding. So do we have knowledge? Do we have something to contribute, something to support? At the Alliance and at WHO, we certainly feel we do. But that is the challenge. So yes, we need considered knowledge, but we also need to meet people where they are and think about what are the settings for knowledge production, for knowledge communication, to be relevant to the challenges that people face. And I think everyone shares that conviction. Secondly, Virchow, one of the many things he said, there's a quotation for any situation from Virchow, is that epidemics are the evidence of human disturbance. And what human disturbance we are seeing, and we are seeing how those are leading to epidemics. Again, the sort of multi-level and multi-system analysis, multi-sectoral analysis that Lucy championed, that HPSR can contribute. Well, again, there is going to be a lot more epidemics, and we're already seeing that from the disturbances we are seeing. So again, how can we bring the assets of our field, this interdisciplinary approach, to this problem to be relevant? And finally, a lot of people have been invoking William Butler Yeats and the Second Coming, his poem about things falling apart and the center not holding. One of the reflections in that poem is that the best lack all conviction and the worst are full of passionate intensity. So as we proceed on our field, let us do science with passionate intensity to put things back together and ensure that the center, but also our peripheries can hold, and that HPSR can contribute that. That seems a worthy mission to go forward. And thank you, everyone. Thank you, everyone online for joining. We have a dynamic field, but we really need to show how we are contributing to this moment. Thank you very much.